I hope you all are having a great time today and appreciate the speakers that we've had so far today. Our final distinguished keynote speaker, Commissioner Clyburn, who is serving her second term as Commissioner of the Federal Communications Commission. Commissioner Clyburn has had a long and exemplary career as a tireless consumer advocate for underserved communities. She is a champion for enhanced accessibility and communications for individuals with disabilities and other vulnerable populations. Commissioner Clyburn has pushed for media ownership rules that reflect the true demographics of the United States, as well as affordable telephone and high-speed internet access, greater broadband deployment and adoption. Her continued efforts allow for closing the gap in access to information that may assist minority communities to make better decisions relative to their health. Commissioner Clyburn, it is our honor to have you here today with us at our conference, and we welcome you. Thank you for your support.
Thank you. Thank you, Luis, for that kind introduction, and good morning, everyone. Good morning. It is great to join you during National Health IT Week. Under the leadership of my friend, Ms. Ruth Perot, and now Luis Billin, NHIT has become one of the nation's foremost public-private collaboratives focused on issues of health disparities and health IT. But with great success comes even greater responsibility, and your team, Luis, they're more than up to the challenge. So allow me a few moments, if you will, as I take you on a short journey with Ruby, a 76-year-old Latina patient with congestive heart failure. She lives alone in Birmingham, Alabama. Her husband died of a heart attack 3 years ago, and while their children are adults now and doing well for themselves, they live in other states with their own family. So for many years, Ruby struggled. She has struggled with at least 3 hospitalizations each year. Even though she was doing her best to watch her diet and take her meds, Ruby and her children constantly lived in fear. But today, I'm happy to report things are much better. Ever since the city installed the new internet superhighway in her community, making life easier and her health a whole lot better. Before, Ruby would worry if today would be the day that she would be rushed back to the hospital, usually in an ambulance with sirens wailing. Now she relaxes, because even before she realizes that things are getting pretty bad, her community health worker gives her a call anytime she gains 3 or more pounds. Remember, weight gain is sometimes an early warning sign of worsening heart conditions. And that new mat that is in her bathroom, which came courtesy of her community health worker, is also a scale that automatically records her weight just before she showers each day. This information is automatically sent to the community health worker and her doctor. And as Ruby would tell it, whenever I gain 5 pounds or more from my target weight, this magic carpet somehow contacts Erla. Erla has become such a wonderful friend. Erla is so concerned about me that whenever I have significant weight gain, she voluntarily analyzes my eating patterns over the last week to see if I've been taking in too much salt, carbs, fats, calories, or not getting enough physical activity. Depending on the results, Erla will suggest simple ways I can adjust my diet. Because I love salt and cooking spicy fajitas, who does not? Erla will sometimes even suggest simple ways I can adjust my cooking. Erla is so supportive. She always finds ways to compliment me for the healthy things that I've done. She knows me so well that she automatically contacts the local grocery store and orders the best foods that I like and has them delivered right to my door whenever I want. I am so happy because I no longer have to worry about catching the bus or standing for hours in the heat, snow, or rain with groceries at the bus stop. Sometimes she even makes a reservation for me at the neighborhood YMCA so I can get the exercise I need whenever my kids want to know what I am doing. Erla keeps track of everything and can tell them anything they want to know. I just don't know how Erla does it. Whenever I need her or just want to talk, all I have to do is turn on the television set and press this button on one of my grandson's game boxes, and there she is. We talk and chat for as long as I would like, day or night. If Erla gets real worried about me, she will actually call my children to let them know what's going on, set up an appointment with my doctor, arrange for my church band to pick me up, and bring me home after that visit. Before I even get back home, Erla comes to my home and leaves all of this wonderful information that explains everything the doctor says in Spanish. She puts these wonderful videos on television that I can watch anytime I need them to help me understand the diagnosis even more. Sometimes my illness is overwhelming and I feel all alone. But if I am unsure and want to talk to someone else who is going through the same thing, Erla arranges that too, right there on my television set. One thing strange about Erla, though, when I met her, they told me her name stands for Interactive Voice Response Lifestyle Assistant. What kind of parent would name their child something like that? Oh well, my children and I still love her. She is making it possible and fun to be healthy again. Now I tell you that story because Ruby is just one of the many true-to-life examples gathered by the FCC's Connect to Health Task Force. For many of you in the audience today, I am sure that with the exception of technology, Ruby's story is very, very familiar. Your passion and your life's work have been a boost to so many Rubies from all walks of life who are struggling with their health and are uncertain about their future. You are making tremendous progress, and your work is to be lauded. For you see, there was a time not so very long ago when few people in this country were unwilling to even admit that healthcare disparities even existed. Today, this conference seeks to galvanize awareness, catalyze action, and focus specifically on tangible, scalable solutions. We have researchers and healthcare providers across our nation studying these problems. We have state and federal legislators crafting policies that over time hold the promise of ending this national scourge. By the way, my Ruby example could just have easily been a wealthy workaholic with a family history of diabetes and no time to eat right or exercise. So these issues affect all of us, regardless of race, gender, geography, or socioeconomic background. But let us not fool ourselves this morning. Despite the awareness, the research and progress, real health care gaps still remain. Too many people are still unaware. Others remain unengaged, while too many experiences and challenges go unaddressed, but they're completely preventable. The British epidemiologist Geoffrey Rose put it this way: there is no scientific reason why one population should be less healthy than any other. Can we agree on that? Yet as a nation, we have been largely unable to close any national health care gaps. You are here today because you don't accept that. The National Healthcare Disparities Report has been tracking our progress for almost 10 years. That's the good news. However, the more sobering news is the fact that we have made no systematic or sustained improvements in any health care disparity. Small improvements, give or take, maybe a year, over a year, but no sustained progress. And some gaps have even widened. While this is unfortunate and oftentimes to us pretty depressing, we cannot afford to be demoralized. After hundreds of years, remember, we still have no cure for cancer or the common cold. But that does not stop us from believing and working. That does not stop us from believing that one day we will cure those ills. In his historic novel, A Tale of Two Cities, you know the quote from Charles Dickens, "It was the best of times, it was the worst of times." So while the continued existence of healthcare divides in our nations may be seen as the worst of times for us, at the FCC we choose to believe that for the first time in history, we may actually have at our disposal the technology needed to serve the health care needs of every single person in this nation. And I am not just talking about curing people when they are sick. I am talking about helping them to stay well. We are living on the threshold of an age where virtually no one is hard to reach in our country. No longer is it necessary for people to go to a hospital, clinic, or healthcare center to receive care. Increasingly, that care can come to you, no matter where you are. Surgeons, using robotic tools, can now operate on patients thousands of miles away. Critical health data can be transmitted wirelessly, and behavioral therapies can be delivered right to their bedrooms, or for a girl from the coast, right to the beach, through readily available communications devices. But providing medical treatment to everyone is not enough, if indeed our goal is wellness. For patients like Ruby, who struggle with loneliness and social isolation, for persons who are not native English speakers and have trouble understanding and communicating in English, for those who do not have reliable transportation and are unable to keep track of their personal health information, every one of these social needs can profoundly impact their health and quality of care. So as a nation, we must find cost-effective ways to address the social needs of patients as well as their medical needs. Telehealth and other broadband-enabled healthcare technologies can assist and connect people to health and support services they need, whenever they need them. So I urge this group to continue to be bold and relentless in pursuing this vision. In order for all Rubies to benefit, they need to be better connected to the social service providers in their communities, their family members, no matter where they live, for distance and geography are no longer insurmountable barriers. We can put a significant dent in all of these gaps and all of these divides if every single person is connected to all the resources they need to be healthy. Connection to these resources wherever they are, and access to these resources whenever they are needed is what broadband connectivity can do. And this, I am proud to announce, is the vision of the FCC's Connect to Health Task Force. And when, if not, when we achieve this vision, the question to all of us is, will we have ended all of these healthcare disparities? The answer is no, but I strongly believe that it will help us make a real, pronounced, and tangible difference. But let me be clear. addressing these healthcare divides or gaps through broadband connectivity is about far more than ensuring that everyone has a broadband connection. It has to be about ensuring that everyone is able to benefit from what broadband has to offer. If only some reap the benefits, if only a select few reap the benefits, we run the risk of hardwiring disparities into our national fabric in ways that may hurt another generation of Americans. Is that acceptable to you? No. Indeed, gaps could actually increase. Is that acceptable to you? No. So the focus must remain on the person, not just the technology alone. For as we saw in the example of Ruby, technology is important, but it is simply an enabler. So as the expert agency on communications technology, the FCC has a critical role to play in the national dialogue on these issues. It's a big task, but we are not shying away. We are bellying up to the bar, ready to roll up our sleeves and get to work. With this vision in mind, the FCC has launched this new multidisciplinary task force, Connect to Health FCC, to explore the intersection of broadband, advanced technologies, and health. We see opportunities to bridge persistent health gaps, to connect rural and remote areas to specialists and specialties to support services that would be otherwise unavailable, to help manage chronic disease, to address language barriers, and improve health literacy, to help our veterans adjust and thrive, and to improve the overall population health and wellness. Simply put, the FCC is working to demonstrate the value proposition of broadband in all of these areas, and we know we cannot do it alone. And this is why we are here with you this morning. We need collaboration, which includes a broad cross-section of stakeholders, our sister agencies who have other pieces of the puzzle, state and local policy makers who hold other pieces of the puzzle, health care providers, nonprofit organizations, innovators, clinicians, academic centers, consumers, technologies, and all of you in this room, in order to ensure that every American can access the benefits broadband has to offer. So I once again challenge you, as I challenge myself this morning, to consider not just the seemingly intractable problem of persistent healthcare divides, but for us to embrace the unique possibilities that advanced technologies and broadband-enabled health solutions can offer. So I urge you to partner with us, partner with others, work with whoever is willing to work with you to eliminate these chronic divides. For I remain convinced that if we are all in, that if we collectively refuse to accept the existence of even the longest standing healthcare delivery divide as inevitable or as the status quo, that if we invest and maximize the tools and promises of disruptive and revolutionary technologies, that if we are willing to take a few calculated risks, go outside the box, our comfort zones, and try some new and creative ways of doing things, that together, my friends, we will be able to make Ruby's incredible, promising story our new national reality. I thank you so very much.
Thank you, Commissioners. Moving up.
Okay, I'm sorry. I'm one of those.
You're welcome. Well, thank you, Commissioner Clyburn, for your kind remarks, and we are grateful for your commitment to our efforts. and advancing health equity by leveraging health IT. And we look forward to working with you and the Connect to Health Task Force as we move forward. And I thank you for recognizing one of our pioneers, Ms. Ruth Perot, who's really been the rock of this organization throughout the years. So thank you, Ruth. The commissioner will be with us for a couple of minutes. So she's going to be with us. But this now concludes our National Leaders Forum, and we're going to break for a brief break, and we'll come back at 11 o'clock for the consumer engagement panel. Thank you.